Hello, my dears. This is Annette of AnnetteLeonard.com, back with a moment for chronic wellness. Thanks so much for joining me. I'm talking today about high stakes doctor's appointments. I have just returned from Seattle, where I, up until very recently, go quarterly to meet with my pulmonary doc, and it used to be my pulmonary team while I was on the lung transplant list. And I hadn't been up to Seattle in more than a year since the beginning of the coronavirus. And largely that was due to the coronavirus and how unsafe travel felt and hospitals felt. And my pulmonologist became more and more insistent that it was time for me to come in for my checks. And I felt a little bullied, felt a little frustrated that we couldn't do my doctor's appointments down here in Eugene, or at least the tests, and then have them sent up to Seattle. And yet Dr. Ragu would not be moved. So I have just returned, as I've mentioned, from Seattle, but I realized that in the weeks, but especially in the days leading up to that appointment, my anxiety was high, my sleep was bad, my irritability was higher, and my pain was higher, which oftentimes tracks lack of sleep and irritability and those kinds of things. And my wife drives me to those appointments. It's about a 5-hour drive up to Seattle, and we are incredibly fortunate in that we have a friend's place that we could stay that was going to be unoccupied. So that cut down on some of our worst fears around travel, and yet being in a hospital for 6 or 8 hours while we did the whole battery of tests and getting the COVID test done, and just having my immune system knocked back from being in treatment the last couple of weeks has made this even harder. And I don't know about you, whether you're someone who has a diagnosis that is terminal or life-threatening, if you are someone who has cancer and has to follow up every 6 months, every year, every 3, every 5. But it's that kind of appointment where we just go in kind of waiting for the bottom to fall out. We've spent so many drives back from Seattle with our heart in our intestines, just trying to distract and deny and bargain our way out of what we've just learned up there, that it now just feels so loaded to go up there that we kind of have a trauma response in the buildup. And I went. It was the first time in a year, and things went okay. I did not have the kind of a decline that my doctors expected and I expected, and to hold steady in the midst of what has been such a horrible year, personally, interpersonally, health-wise, feels like a remarkable gift, feels like a little bit of breathing space, and does not diminish how hard these high-stakes doctor's appointments are. And I wonder about you. I wonder about which doctors are your high-stakes doctor's appointments, and what kind of self-care you practice to make those any bit more manageable. So sound off, leave a comment, meet me over on social, and ask a question, send me an email. I'm always glad to hear from you. And if you haven't subscribed here or wherever you're listening, I hope that you will. And until we're together again, I thank you for your time and attention. It is my sincere hope that you are finding ways, in spite of chronic illness, to live well.